Thank you, Dr. Bluhm, for joining us today. We're excited to have you here.
Thank you so much, Cindy and Anne-Marie, for this invitation.
Yes. We're going to start off by asking exactly, can you briefly explain what EFT is? I know it's
Emotional freedom technique. And it's really a simple way to sort of de-stress, and it's evidence-based. There's a lot of science to it, which shows that it is effective for a number of people, especially those who are stressed.
Right. Which is all of us.
Yeah, pretty much everything.
Especially around the holidays.
Yes, it's very, very useful. Yes. Yeah.
What are the core principles or scientific theories behind EFT?
So EFT is actually based on Chinese medicine, which has really been like several centuries of evidence for it. So it follows the meridians. So in Chinese medicine, the body is divided into meridians. And the theory behind is that activating those meridians, specific meridians, you can actually release and activate your body to help resolve the stress that you are experiencing.
Okay. What are the meridians? Are they head to toe?
So yeah, the meridian is normally head to toe, but for EFT, there are only a few meridians that we touch on.
Okay.
Yes. And I'll be doing a demonstration later on if you want, and we could also orally go through it so that individuals can follow us.
Oh, that would be
perfect. Yeah. How does EFT differ from other forms of therapy, such as cognitive behavioral therapy or meditation?
So cognitive behavioral therapy has different types. Yeah. So cognitive behavioral therapy, for example, you would need to have a lot of training in order to do that. You need a therapist to do that. For example, meditation, mindfulness, the classic mindfulness needs you to attend a lot of training, at least 2 weeks. I think nowadays they're actually thinking of shortening the training, but you still have to do the training. So EFT is simple because it's something that you can do, the movements of the hand, tapping. It's otherwise called tapping. And it's something that people can learn within minutes. And it would just be easier for them to incorporate in their lives and also do when there are situations that need them to be more relaxed.
Yeah, something really quick that you can just do. That's good.
Yeah.
Yeah, that's one of the things that I like about it. I am a proponent of empowering patients in helping themselves. Sometimes, especially with stress, there's a lot of stigma with it. And so people may not be are more likely to get out of their way to seek help. And sometimes they say, this is going to go away, or maybe everyone's stressed. So what's so different about me? So stress is part of life. Though we are alive because we feel hungry, and hunger is stress, right? But it could be in a way that it actually hinders the quality of your life. And that's where EFT or tapping would come in handy.
Okay. Is there a personal story that you have where you've used EFT?
So for myself, I've actually used it to just relax, but I have also had studies with veterans and also have collaborated with VetTrip. This is a local nonprofit that actually provides a lot of complementary alternative interventions to vets who have PTSD or are just wanting to have a better quality of life. And EFT is one of these things that they have actually started to do interventions and teach the veterans.
Okay.
And it has been really, from the tales of these, from VetTrip participants and from my studies, they have really said, when I'm waiting for my appointment and the doctor is not there, I just start tapping, and it helps in So that by way of that, I feel that it's really very useful.
Yeah.
So wherever I go, I talk about tapping,
Yeah.
and especially when people are like wanting some avenues, and I always started with like, does anyone feel stressed? And I get a laughter from the crowd because who is not stressed?
Yeah.
Mhm.
So you mentioned veterans and PTSD and a little bit of and stress. Are there any other specific emotional or physical conditions for which EFT is effective for?
So anxiety, depression, I think just basically you don't even have to have those, but where you are in a situation where you just need to feel a little bit more relaxed. The way of EFT, aside from the tapping, is there is actually a positive reaffirmation of like how you view yourself and like loving yourself despite the stress or the pain. A lot of individuals do with pain use it because it helps them like manage pain, and like there has been reports that pain reduction and also like their mental state is a lot better after EFT.
So do they usually focus on like one thing and they just work through that through the EFT process?
Yeah, so there's different mantras. So it depends on what you are feeling. So if, for example, if you're stressed, like one of the mantras could be like in spite of my stress, I choose to love myself. Yeah, something like that. So very, very simple. There's nothing like commitment or whatever, but but that's just vocalizing it helps the individual to feel that emotional.
How long does it take for them to feel the effects, the positive effects?
So I have the way that it is. From my experience, within minutes that I have like felt really relaxed, but you can keep on doing it until you feel so the way, and we can go through the process later on, but when you start your EFT, you kind of like self-reflect and rate how much you're stressed or the pain you're having, and then you can then assess after like one round or two rounds like how much you're feeling, and you can, because you're just using your hand, wherever you are, you can just repeat however many rounds of EFTs.
This is so easy.
Yeah.
Can you walk us through the basic steps of a tapping sequence?
Yes, of course. So it's just using your hands. So this is called a karate chop because like your karate here. So that you use 3 fingers and then you just basically like tap like that. Yeah, tap like that. You can do
just on your hand.
Yeah, on your hand. That's one.
Okay.
And then you can have 2 fingers. So it's 3, 2, and then your whole hand. So it depends on the body part. Some people like that can do the whole hand with 3, and then you do here on the side, on the forehead. So it could be one side, or you can do both. So some people just do this, and then there's another meridian here,
like above your
eyebrow.
eyebrow.
So you start with above your eyebrows, and then side here, under your eyebrows, under your nose, on your chin, and then here you can do like this, or you can do like this on your chest, and then under your arm, about like if you put your palm under your arm, the space under it would be the one that you tap. Okay, and then the last one will be here, 3, right? Yeah, that's just basically it. And then you just rotate. And while you're doing that, you could say like, despite my stress, I choose to love myself, or whatever affirmations you feel right for that moment.
Do you tap so many times?
Yes. You could just like
1, 2, 3.
Yeah, 1, 2, 3. Yeah. 1, 2, 3. Yeah. So there's a lot of kind of variation, whatever the individual feels.
Yeah,
so yeah. So you can do it by yourself, but like 3 would be, for me, I do like 3 at a time and then move on to the next one and then see how I feel at the moment. And then if I feel that I need it more, and then I just go through that again.
That's cool. It's just so easy.
Yeah. So you can start with a deep breath, and And then at that time, you kind of self-reflect and self-feel yourself, like, what is the level of my stress right now? Since I'm in a podcast. 6. No, I'm with friends, so I'm not really very stressed. But you say like 5 right now. So then you can breathe in, breathe out, and then you can start,
Do you
nice.
think-
Yeah, and then you do like this here. So you can do, of course, it's only one here,
Yeah.
and then here. Yeah, so yeah,
Okay.
that's pretty
cool.
much.
Is that something that people can practice on their own, or is it best to do it with a professional?
No, people practice them on their own. I have not seen any difference. Well, if you actually look it online, there's a number of influencers who are bringing it out there.
Oh, wow.
Maybe variations of some, but it's as you can see, it's really just stopping, right? And then the meridians and so on and so forth. So I don't think there is a need. Of course, I think there's now a growing science in healthcare where alternative complementary medicines and interventions are embraced. So there could be therapists and psychologists that actually can provide you with training and show you how to do it. But as far as I know, and from the friends that I know in VetTrip, for example, we teach them on how to do it. Yeah.
What is it, VetTrip?
So it's a veteran immersive integrative process. Okay. So it's a nonprofit here in San Antonio. They're pretty awesome. We partner with them, and they provide complementary. So they have like aromatherapy, massage, acupuncture. And they teach skills like this so that when they're outside, they're not having the massage and aromatherapy. They are able to manage stress, because of course individuals are more stressed when they're outside in the world compared to when you're in a massage setting, right? Sure. So it's pretty awesome. Like they're really, really like group of people, and a lot of them are they're volunteer veterans who help facilitate, and they have therapists that come through. So that's what I partner with them, and they're really good. That's service. Awesome. And that when I first knew them, they actually had me like, why don't you come and just experience the whole thing? And I said like, okay. And I have to be honest, well, like after the whole thing, I cried because I never felt so like kind of loved, and like all the attention on me with these people, like like helping me relax. And so, yeah, you should check it out maybe in the next podcast.
Yeah.
Oh, that's great, because there's a lot of veterans who feel like they're just out there on their own and they're waiting for VA healthcare. I mean, this is a great thing that they can do in between.
Yes.
And then they can learn it and do it on their own, but just to know that there's a place that they can go to if they don't have anybody. Cool.
And VA actually has now, from what I heard and I've observed, VA has now opened up a lot of services too, which are complementary alternative medicine. So, which came from actually requests from veterans where they have found polypharmacy really were affecting their quality of lives. They take one medication and then they have to take another medication for their adverse events. It's like we want non-pharmacological approaches to address our pain, psych mental health issues, or just like improve our quality of life. And so I'm really happy about that. And there's like a whole team in the VA.
Oh, good. Yeah. Are there any common mistakes that newbies do when they're first starting EFT?
Not that I know of, but I think if there is anything, I would not label it as mistake, but I think incorporating it in your life takes a little bit of time. So I think just making sure maybe like when you wake up, and so it becomes part of
like a routine.
It's kind of like learning meditation. You have to practice.
Yes. And like I had a study which was mindfulness among veterans, and it really makes a lot of difference, because like they would say something like, like I usually, one of my vets was saying, I usually have, she basically has routine surgeries because of her condition. And so she was part of my study, and she came, and the doctor turned around and she said, like, you're acting like differently. It's like, I'm doing mindfulness. And then they're like doing like this. So like people are like, what are they doing? Really? Like they're like something like they're tapping here and everything. Like, yeah. So and it's something like you don't even have, if you feel self-conscious, you can even just do your hand.
Yeah. So this is a good lead into the next question. Does their current scientific research what does it say about the effectiveness of EFT?
So it's one of those easy interventions out there that has a lot of evidence. So it's one of those evidence-based interventions that like individuals can apply for themselves and can do by themselves in where they are, wherever they are. So there's no like extra contraption that they have, or they have to be in a specific setting, which is really, really convenient, because when you are stressed, you don't choose like, okay, I'm in this setting and I need to be, or like bring a whole harness with you to be. So yeah, that's one of the things that is coming out in the literature. And there's like a lot about, it used to be like on the mental health sphere, but now like people with cancer, for example, like people who are in pain, chronic pain, and so on and so forth. So it's going out there that, it's effective.
That's great.
Yeah.
I mean, you can do it while you're waiting for your kids in the school pickup line.
Exactly. Yeah.
Do you usually use EFT in conjunction with another type of therapy, like acupuncture? Is that
That's an option for the individual, but you can definitely do it if you feel that you need more. I think there's also a lot of evidence for acupuncture, and so it's up to you whether you want to do that or you want to just keep on by itself.
Okay.
What I would say is that if you are having a condition where these things are not working, or maybe it's reducing, but only for a short period of time, do talk with your mental health provider, because that you may need more than just this non-pharmacological approaches. Yeah.
Have you ever done acupuncture?
I had acupuncture when I went for my back pain.
Oh, wow.
They put needles all in my back and then stimulated it.
Me.
If you don't even feel it.
Oh.
Now you don't feel it.
Just don't look at the needle.
I'll be like,
yes, exactly, while you're doing it. Yeah. I actually was a very young age, like in the Philippines, I don't know why, but I had like a lot of cough, and like, like we were like medications and stuff, and then my mom brought in like an acupuncturist, and she did it, and I didn't have a cough.
Oh,
wow.
After, right. Yeah. So it was like, wow, like, and that got me like at a very young age, like this works.
Yeah. You tried my allergies.
Yeah. All the alternative medicines, I'm very curious about.
Yeah. Yeah.
Are there ongoing studies with EFT or any new findings that you know?
So I actually wrote a grant for EFT. I unfortunately wasn't funded, but certainly something that we can always I think making it a part of like things that we do, because it doesn't cost anything, especially with the cost of healthcare nowadays. Wherever things can help you without cost, I think it would be very, very useful.
It's so convenient.
Yeah.
How can EFT be integrated? Do you want to ask that question?
Yes. Integrated into daily routines and self-care practice.
Yeah, so it's like in everything, right? Like make it part, maybe like in the morning you do it, and or in the evening you do it. You find, or like maybe lunchtime. I think making time for it is very, very important. It's like any other habit, right? Making time for it is like carving a time out of your day would make that a part of it. And then maybe like just being conscious about how you feel.
Yeah.
And so when you feel that stress, or like you find yourself floundering throughout the day, or you don't have that energy, like, like take a pause and just starting, just do the top.
Is there ever a situation where it wouldn't be productive? Like if I'm stretching at the end of the workout, would you not recommend to do EFT because I'm not necessarily focusing on that, or I'm focusing on maybe too many things?
So I have not kind of heard about that, but I think what it might do if you want to do it at that time is help you focus on yourself and like finish off your workout. Yeah. So I think that's the beauty of it, is that the individual can choose when to do it, right? Yeah.
Yeah. So what advice would you have for someone who wants to get started?
So the advice is to kind of follow what we showed today, but also if you forgot or you want to go to another, there's a lot of resources online, and you can just look for EFT or tapping, TAPPING, and then you'll be able to follow through. So, and the other aspect of it is like, the awareness, even just breathing in and out, I think it helps in the process. Like you just, like it's a break from all the things that you're experiencing and just focusing in yourself and take that deep breath and then start.
That might help, like when you're driving around San Antonio and you have all the road raging.
Exactly. The traffic nowadays are like horrendous.
Start tapping in your car.
Yeah. Just don't tap the just don't do the honking as you're tapping. Yeah.
So how has EFT impacted your approach to mental health or well-being?
So I really like it because, one, as a healthcare, I'm a nurse. So one of the works of nurses is really kind of education. And so I always I'm also a nurse educator. I work at the university. So I tell my students, like, when a person is in the hospital, I feel it's too late. I think we want to keep them healthy in where they are. Yeah. So like having this one of those approaches that I can share with the community, maybe help them like, manage their stress to a level with something that they can cope with whatever they're experiencing, their stress, their pain, so that it doesn't escalate to a higher level where they would need emergent acute care. Of course, if they need that, they should seek help. But I feel like it's one of the armaments that we can actually deploy to the community so that it can help them with their quality of life.
Yeah.
I like that because especially as women, we're doing so much for all the time for everybody else, and you don't realize it until one day maybe you just feel overwhelmed with stress. So just being able to do this here and there would help that.
Yeah. Sure. Before you have the breakdown.
Yeah. So before coming here, I was at the Best 25 Nurses, and we practiced last night. I was another event before that, and they back-to-back events. So well, things were going on. I was just like closing my eyes and doing like this, and they were like, it's like, are you napping? It's like, no, I'm just like getting myself together and getting ready for my podcast.
Tapping in.
Yes. Tapping for my tapping podcast.
What are some misconceptions about EFT that you would like to address?
So I have not really heard anything out there, but I think maybe like, there are individuals that do not believe with the Chinese way, more traditional, non-pharmacological. And we respect them, each to his own. But at the same time, if, be open to others in this non-pharmacological aspects of things. And no, I don't remember anything. Okay. So, yeah.
It's
Just try it. You
Yeah.
don't know if it's gonna work or not. And if it doesn't, you tried it.
do you recommend
For anything, you're like exercising your hand.
Yeah, right. I burned some calories.
Yeah, burn
Yeah.
some calories there. Yeah.
Are there any websites or videos that you would recommend people could find?
Yeah, so there's a lot. There's
There
a
are.
lot in YouTube and even like scientific. You can just EFT, and there's a lot of like peer-reviewed journals, peer-reviewed articles that actually use EFT. Yeah.
Oh, good. I'm sure on TikTok it's all over too.
Yes. Yeah. So yeah, it's very helpful.
So go to YouTube,
Yeah.
type in EFT, and
Yeah.
follow along.
Yeah, or tapping. Yeah.
Or
yeah.
tapping.
Then if they want to have more reliable like results, they can look for even like in the main like Google, and then it would actually show published articles on EFT.
Are there like mantras that you can kind of look at to see, just to get an idea of what?
Yeah, so those videos I have seen, like they have like variations of the mantra that I shared with you. I think mine is the simplest one. Like you could see like, like I see the beauty of the world or whatever, but I like it simple. I love myself.
Yeah.
But it's horrible. It's okay though.
Do you prefer they be in a quiet place? Or if they're in their car in traffic and they're stressed out?
Yeah, I think that's fine. This is where the advantage of it, where, for example, like mindfulness, you have to be in a quiet place.
Yeah, right.
And of course, you can do it in a non-quiet place, but with this one, like wherever you are, and from what I have seen, like when I walk to the VA, I would see like a lot of the vets, like
so
while
good.
they're waiting, like they're doing like this. So yeah,
It seems like it's almost a distraction too.
Yeah.
So if you have pain or if you're just frustrated, like
Yeah.
tapping, it might be a little bit of a distraction.
Yeah, exactly.
Is it important to tap in a certain place or a certain sequence? Do you start with the hand, then move to the...
So, like, I have not heard anything to the contrary, but the practice has been like the hand, and then you go to the forehead, like this one, and then under, and then it finishes right on the top.
Oh, okay.
Okay. And then until you just feel better, relaxed, and then...
Yeah.
Okay.
But as mentioned earlier, like if you feel self-conscious about the whole thing, you can just do the hand chop because it's the least
noticeable.
Yes.
Yeah.
Because for example, at this event, like we were like honoring nurses. I feel like like me doing like this, like
True.
monkey me, like so I was just doing like this, and I was just like nobody would know except for the one with like was beside me, like noticed it. But it's as if it's almost like when you're like tapping your feet or something like that, and like nobody would notice.
Right.
Yeah. If somebody wanted to learn more about it, are they able to contact you?
Oh,
And
sure.
How can they contact you?
So, like, I have the Center for Filipino American Health is my website. And so we have, like, if you scroll down to the bottom, you can write a query.
Nice. We'll add that to it.
Yeah. Did you want to walk us through a sequence of how to do
Of
it?
course, yes, yeah. So we can do breathe deeply. So whatever you're feeling right now, if you're in pain or stressed, you can, that could be the work that you're on. And then, so you feel, breathe in, breathe out, and then you feel like, what is the stress level? So you need to rate it from like a 0 to 10. So breathe in. So a number would be good. But a lot would be acceptable. So we're pretty open here. And so you can start with a karate chop.
And that's on
So
the
so that's on the hand, like on the side of the hand. And then that's where you do like in spite of my stress or pain, whatever, or nervousness, whatever you're feeling right now, like I choose to love myself.
Do we say this out loud?
Yeah, you say it
I
loud.
choose to love myself.
So whatever affirmation, you can be like, it could be more than the love, like, I am there, like whatever that is. I go for simple things. I just want me to love myself.
Yeah.
Accept, they could, like, sometimes there's accept. I choose to accept and love myself is another version. I don't have issues with acceptance of myself.
I think everyone needs that one.
Yeah.
Okay.
Everybody.
Yeah. Accept and love myself. So accept and love myself.
Yeah.
Yeah, you do that. And then you go to the side.
The temples?
Yeah, the temples side. So you can do one finger
Or two.
or two. So we're obviously over achievers. Two. And then on here, on the brow area.
That feels good.
Yeah.
I know we're not supposed to talk during this.
Yeah. So you can do your affirmations.
I choose to.
In
spite of my stress, I choose to accept and love myself. And then you go under the nose. In spite of my stress, I choose to accept and love myself. Then you go to the chin. In spite of my stress, I choose to accept and love myself. And then you go to your collarbone. You could have your palm or your finger, whatever. So we could finger and you say, in spite of my stress, I choose to accept and love myself. And then you go under the arm. Remember, you put your one hand and then it's the space under it. In spite of my stress, yes, I choose to accept and love myself. And then you go top of the head, right in the here. In spite of my stress, I choose to accept and love myself. And then you breathe in. Then you assess, has the stress level gone down? Do you need another? So it's a free time. Like, it's up to you. It's your
So you can do it as
decision.
many times as you want. Just keep going.
Mhm.
Okay.
Yeah.
Relaxing.
And you can't help but tell that if you do this, it also helps your wrinkle. Yeah, it's like wrinkle prevention. Yeah, so now we're like exploring the many things, the aspects of EFT.
Well, this was really good conversation. Is there anything else that you would like to add about EFT?
Yeah, no, I mean, like, give it a try. Of course, it may, it depends on the individual because stress is a very personal thing. The same as pain is a very personal thing. So, but I'm hoping that this could be one of the things that you can do, like, your armaments within yourself that can help you cope with whatever you're experiencing and improve your quality of life and keep healthy.
Yes.
Yeah.
I think it's very helpful around the holidays. Tapping your hand. Yeah.
Or it might be good to let them know so they're cued up that you're stressed and to like kind of lay down low.
Yeah. You alone.
In spite of my family.
Thank you so much for joining us.
Hey, no problem. Thank you so much for having me.
Yes. Thank you.
So you gave us your website. Is that your preferred contact?
Yes.
Okay.
Awesome. Thank you.
Thank you.
Yay.
Thank you. Thank you for all you do.